COVID is once again in retreat. That's according to the New York Times this week, with new cases falling by more than a third in the past month across the nation, and similarly here as well. But we've been here before, and this time the experts are shouting louder than ever. The only way for it to stay in retreat is if we all do our part, as the great Dr. Fauci reiterated yet again this weekend.
The best way to assure that we'll be in good shape as we get into the winter would be to get more and more people vaccinated.
Of course, if the past few months have taught us anything, it's that it's an uphill battle that's getting steeper by the day. Over the weekend, we as a nation surpassed 700,000 total COVID deaths. 700,000. More than 100,000 of those deaths have come since shots were made readily available across the country, and most who've died in recent months have been unvaccinated. Yet still, crowds were out yesterday protesting New York City's new vaccine mandate for those who work in schools, even going so far as flipping over a testing table and tent in their anger. Anger, I want to emphasize again, over a vaccine that saves lives. A new Health and Human Services report finds vaccines have been linked to 39,000 fewer deaths, 100,000 fewer hospitalizations, and more than 250,000 fewer cases among senior citizens between January and May. And for all those who got a J&J, Johnson & Johnson shot, have been anxiously awaiting word of a booster, today's a big day as J&J has officially asked the FDA to authorize an additional dose of its shot, which they say would provide 94% protection against moderate to severe COVID cases. Of course, another big game changer will be when younger kids become eligible for vaccines, and to that end, the Baker administration is reaching out to local health officials to start planning that next key phase of the rollout here in Massachusetts. Joining me to talk about all of this and more, Dr. Cassandra Pierre. Dr. Pierre is an associate hospital epidemiologist at Boston Medical Center and an assistant professor at BU School of Medicine. And Dr. Lakshman Swamy, he's a critical care physician at Cambridge Health Alliance and instructor at Harvard Medical School, and the creator of a new board game called Critical Care, which we'll get to a little bit later. Doctors, it's very good to have you here. Thank you both so much for doing it.
Great to be here.
So starting with you, Dr. Pierre, cases are down, as I said a minute ago, not just in high-vax states like ours across the country. Why? And does that mean we're finally on the verge of coming out of this?
Well, COVID seems to thrive on our short-term memories, unfortunately. And so every time that we think that we can start throwing away our masks and planning big blowouts, it comes back. We've seen this cycle of infection. And the numbers on the decline are great, but we know we're heading into the fall and winter where people start moving indoors, celebrating holidays. There are estimates the numbers will rise again. The trick is really to ensure, as Dr. Fauci said, prioritizing vaccinations and giving people a real sense of how this virus spreads so that we can continue to protect ourselves. But we are not out of the woods.
So even if we're not out of the woods, Dr. Swamy, I still don't understand, in low-vax states, the number of cases are going down as well. What's that about? Just a cyclical kind of deal or what?
I think it's this idea that there's this almost cycle where we see cases go up and down, not always exactly in tune to what we expect, right? Like you said, lower vaccination states, we're seeing cases come down also. It's easy to try to pin the human narrative on everything that happens with COVID. I don't think it's that simple. I think human behavior and vaccination rates are hugely important, but they don't tell the whole story. Honestly, I don't think we totally understand why the virus ebbs and flows completely as it does. But you're right, we see that happen.
Dr. Pierre, let's go from cases to vaccines. I know you just got a grant to study communications and what went wrong that prevented, infection protection amongst people of color. But in Massachusetts, when we spoke to the governor on the radio, several weeks ago, I know we were topping most other states in terms of vaccinations of Hispanics and Black members of our population. But how are we doing in this state as compared to the vaccination rate for white people?
It's still low, and we're still off by, depending on the community, a percentage rate of 10 to 15, as much as up to 20% difference in terms of gap between white and Black or Latinx. And that's a really big gap. We know a lot of the reasons for it. I know that you spoke even this morning about what we're seeing in communities of color, the weight of centuries of oppression, misinformation, and experimentation in communities of color, and the reason for low vaccine acceptance and vaccination in those communities. That is a bridge, even as good as we seem to be, and as we're patting ourselves on the back for, a real gap that COVID will exploit, or continue to exploit come this winter, probably, as we gather together indoors again. So it's incredibly important to continue to push the narrative of vaccination and the knowledge that we have about safety and efficacy, including and especially in Black communities.
But you know what's doubly troubling to me, Dr. Pierre, is I'm reading a piece, I think it was in USA Today, with some experts like the two of you, talking about when the vaccine is available to kids 5 to 11, virtually all experts expect kids of color to have access issues like the adults did, to which my reaction is, did we learn nothing from the last 18 months in terms of how to prepare kids for the vaccine when it's available? Did we learn nothing?
Again, COVID seems to exploit our short-term memory, or the gaps in our short-term memory. I share your frustration. I think that, we've heard that even parents who are vaccinated continue to have reservations about the safety of COVID in our children. And so that is one big stumbling block or barrier that we'll have to encounter. The others will be the lack of access issues that continue to persist in areas. And this is not just a generational issue in terms of lack of access. This has been a centuries-long issue that we have to navigate, regardless of what we've learned in the past year and a half.
You know, Dr. Swamy, if we can stay with kids for a second, every time I have a simple solution to a problem, I know I'm wrong. So you'll have to tell me where I got it wrong here. It seems to me that when you talk about particularly kids, poor kids, kids of color, who are going to have problems with access, the solution is so easy. Do what California has just decided to do, mandate vaccinations, COVID vaccinations, for kids when they're available, obviously, just like we do for so many other vaccinations, and to be sure that they get them, give them to them, make them available at the schools. Isn't that the obvious, I'm not saying it's a total solution, isn't that the obvious antidote to this problem?
I mean, I think you're on the right track. I think with vaccines, I always think of it as a push and a pull at the same time. You know, we push people to getting vaccinated by mandating it. And I think that will have a huge effect in California. And I hope to see that elsewhere. Honestly, I think it works. On the other hand, you can't just push people. I mean, we saw the anger. We see it everywhere. Maybe less so here, but it's everywhere about being kind of pushed like that. So we got to pull too. And we have to help convince people that it's safe. We have to go to where people are in their communities. And in this case, like you said, we have to go to them in their schools. I think there's a lot of trust for teachers. There's a lot of trust for school nurses. And we can leverage that. We can go to where they are, and I think we can get shot from others.
Why can't we push? I mean, I was just looking at some numbers this morning at Kaiser Permanente. I'm sure you've seen them. From the mandate, pre-mandate, I think it was 78% of the 300,000 people who work there were vaccinated, Dr. Swamy. After the mandate, I think it was 2 weeks later, give or take a couple of days, 97% were vaccinated. Why can't we push people in the direction of mandates? They do work.
You know, I think that we have to be careful because there's different populations of people who are saying they're hesitant or refusing the vaccine, right? Yes, you see the people in the news who are throwing tents down in New York and all that, and that anger. There's also a lot of honest fear. And that's what I see in a lot of my patients, especially patients of color in safety net hospitals in the city. What I see is people who are genuinely confronted with as much concern that the vaccine will give them COVID as they are that COVID is worse. So we got to get to people.
You know, Dr. Pierre, I know, as Dr. Swamy described the hesitancy, I know it's there. The head of the League of Community Health Centers, Michael Curry, was on a radio show this morning saying almost the exact same words Dr. Swamy was saying. I'm sure you would agree. And in terms of vaccine hesitancy, the other thing I worry about, the other night here I was celebrating this huge breakthrough, it seems to me as a layperson, with Merck's announcement that there may be an antiviral pill where you get COVID, and as long as you take this pill early on, again, not proven yet, but as long as you take it early on, the development of the disease as well as the transmissibility of it will be capped or at least inhibited. But when I went home that night, I said to myself, that's going to give even a further excuse for vaccine hesitant people not to take a vaccine, because they're going to say, even if I do get it, which I won't, but even if I do get it, I just take this pill and all is right with the world. Is that a legitimate fear? I think it is, no?
Yeah, I think there's a concern both that people will conflate treatment as, an excuse to forget about prevention, and also the concern that as good as this medication promises to be, we don't have the study here to actually look at who it works for and how well it works in different situations. We won't have access issues to those communities that have been hardest hit and more socially and financially vulnerable, and the global stage where we have seen patents continue to prevent access to things as we would think as basic as vaccines. But, this is wonderful news. You were right to celebrate it. Absolutely. I do think that our messaging has to be on point to continue to state, though, that as good as a medication is in preventing disease, and, we did see decreases in hospitalizations and deaths with this medication, at least has been reported, but it wasn't 100% reduction, right? So prevention continues to be the mainstay, the way that we are going to, I used to say, get out of this pandemic, but at least make it more manageable for us at this point.
Dr. Swamy, I want you to listen to what one of the world's great experts on boosters had to say when he was asked by Adam Shapiro at Yahoo Finance if he was going to get a booster. Here he is.
Well, if I felt it was necessary, I guess I have sort of a double vaccine because, as you know, I had it. I, in addition to that, got the shot. I mean, I'm somebody that tells people I'd like to see them get it. I also want them to have their freedoms, etc. But I got the double shot.
Is there responsible commentary from former President Trump? Does that still hurt the effort, or is he like ancient news on this issue?
I think the truth is that, to me, ancient news is an understatement, but there's a lot of people who still listen to the former president. So I think if we can get any messaging out there that encourages people to get vaccinated, I think it's worth it. I think that message is really going to be taken in different ways by different people. It's going to be spun in many ways. So I worry about anything that comes from the former president and trying to end this pandemic. But we'll do what we can.
So, Dr. Pierre, on the booster front, my understanding is if things go well, for those of us who got Moderna or Johnson & Johnson, by mid-October, I think the meeting's the 15th or 16th, there will be a recommendation that a booster, or some people say it should be called a third shot in the case of Moderna, a second shot in the case of Johnson & Johnson, will be approved. Is it likely that the FDA, or whatever the appropriate body is going to finally answer the mix and match question, even though I assume it's less important when all three are approved? But will that be answered by people in D.C.?
I think it's still an important question. I don't have any evidence to say that they're going to also take on the issue of the mix and match for the second or third dose at this time. They've been waiting for, they really want to be as science-based as possible and take a look at evidence that specifically looks at Moderna, Pfizer, and Johnson & Johnson with mix and match doses, and we don't have enough data on that available quite yet. We have other vaccines. For example, the AstraZeneca, similar in terms of conception and design to the Johnson & Johnson. We do have evidence about the safety and efficacy of boosting with an mRNA vaccine, but we don't yet have that for a lot of others. So I think when the decisions about the booster doses for Moderna and Johnson & Johnson are made, I think that it may come up to individual level decision-making about whether mix and match will happen, but I don't have any evidence that FDA will actually comment.
Dr. Swamy, I only have 30 seconds left. When one of my coworkers told me this morning that you were also the co-developer of something called Critical Care, the Game, I assumed they were joking. They're not, are they? What is this thing?
This is a project I started on when I was working in the ICUs at Boston Medical Center in the heat of the first COVID surge. It was really a dark time for all of us, and I kind of recreated the ICU before COVID. And I realized, talking to the public so much, that the public doesn't understand what we do. So I really wanted to share that this is a game for everyone, 14 and up. You can learn about medicine, but really it's just fun, it's cooperative, and it celebrates healthcare workers.
Okay, so if I can watch Matamodio on Jeopardy, I can play Critical Care, the Game as well. Dr. Pierre, Dr. Swamy, it's great to see you both. Thanks for your thoughts. I really appreciate it.
Thanks for having us.
Thank you.
Thanks for having us.